I was assigned Janet, the triage nurse. Mr. and Mrs. Romanoff was a young couple who were expecting a child. They were seen by Dr. Baxter at the end of the visit, and they were told to see the doctor within 7 days. As they approached the secretary, she seemed preoccupied. The Romanoffs told the secretary what the doctor said, and she told them that their request could not be met. After trying another avenue, she ultimately failed to get them to the appointment that they needed. 17 days later, the Romanoffs presented to the hospital with complaints of back pain. The secretary at that time told them she needed paperwork that they could not provide. After telling her they did not have it, Mrs. Romanoff winced in pain. The secretary asked if she was in labor, and there was clearly a language barrier because neither of them answered and just stared at her. The secretary told them to go and to wait in the waiting room. 2.5 hours later, Janet, the triage nurse, saw them. She did her initial physical examination and noted some cause for concerns. She noticed decelerations on the monitor. These were the first words out of her mouth. She should not have said anything about the decelerations because she was not adequately explained what they were because of the language barrier and the lack of knowledge. She then reassured the Romanoffs that everything would be okay and she was going to admit them to the labor and delivery unit where they would be taken care of. Ultimately, Mrs. Romanoff died because of flaws in the system. The staffing was not adequate at all for nurses or doctors. It seemed that all of the staff was being overworked and had no extra help. The fact that either secretary did not give undivided attention to the patient during their interaction was unacceptable and very inappropriate. The patient had to wait 2.5 hours to be seen by anybody after complaining of pain. The patient was seen by multiple nurses, and that can cause things to fall through the cracks because there was no adequate continuity of care. When the nurse told the doctor about the problem, he blew it off to go see another patient, and he sent a medical student in to see the patient. Once the medical patient saw her, she noticed that there was immediate cause for concern and told the doctor. The patient was rushed to surgery, and the husband was not told what was going to happen. It seemed that there was no informed consent obtained, and neither Mrs. Romanoff nor her husband were given a plan of care. Anesthesia was unsuccessful with the spinal tap, and the surgeon did not want to wait any longer, so he decided to induce general anesthesia. The anesthesiologist told him to wait so that he could maintain an airway, and he did not. The patient lost their airway, and anesthesia was unable to oxygenate Mrs. Romanoff. Once the baby was out of the mother, the pediatrician was tasked with resuscitating the baby. Once successful, the pediatrician told the nurse to give vitamin K. The nurse did not check the bottle and gave the wrong medication. Instead of dealing with the situation, the pediatrician told the nurse to call pharmacy and to deal with the medical error. There were many flaws displayed in this video, flaws with the system and flaws with the staff that could have been avoided if there was quality care going on.